Hi, my name is Pooja Pillai and I work with Project Burans, a mental health organization that works under the larger umbrella of Emanuel Hospital Association. This is a unit of 22 hospitals that work in the north of India. One major challenge that we faced during this pandemic, during this crisis, is that we saw an amplification of pre-existing challenges that we had before the crisis. So, for example, we're dealing with communities that have very high food insecurity, and we're dealing with people who go to work every day and earn their wages daily. So it was difficult for them to actually get money when the lockdown was announced practically overnight. And for them, it was difficult to actually imagine mental health and self-care and positive thinking when they do not know where the next meal is coming from. That was one challenge we had. And the other challenge we had with many of our clients who were going to the hospital to get medication is that there was no public transport available. They did rely on public transport a lot to get around, and they did not have any private vehicles. Neither did they have friends who could lend them vehicles. So that was also a major challenge with access to care. So to address the challenge of obtaining groceries or basic essentials on a day-to-day basis, we actually work with the volunteers in the communities who are on the forefront with distribution of essentials. So we work with the police who already have a list of those who have received essentials and those who haven't. And we take police to the communities that are on the sidelines so that we make sure that they get groceries, they get the essentials from not only the government supplies, but also from private funders who are willing to supply essentials. Apart from this, when it comes to issues with supply of medication, we have tried to arrange for transportation to get people to the hospitals to obtain medicines. And on top of that, we also developed a Moodle platform. That's an e-learning platform for sharing information with our community health workers. And it is actually free to access for everyone in the Hindi-speaking belts as well. One thing I would suggest is to actually take care of yourself. You know, self-care is quite important during this time because this is an anxiety-inducing time for everyone. Like the whole world is in a panic. So taking care of yourself, having the mental energy to actively listen to someone else's problems and to work in highly marginalized communities is really important. And as a team, we have tried to check in with every one of our staff on a daily basis to make sure that the situation in their own families is fine and that they're able to cope well in this current situation. And if they are able to cope well, then it is also easier for them to help someone else through this crisis. So that's one approach that we have taken up that has been really useful. And the other thing that we really suggest as a team is to make sure that the communities you're working in, you have a good network there in the communities. We need to be able to listen to the actual needs of the community. Like we are a mental health organization, yes, and our strength is in mental health services, but we realize that the need of the hour is actually food, you know, to actually get essentials to the community. So actually tapping into the existing networks and trying to sort as much of the other problems as well parallelly is also really important.